Hi, so my name's Beth. I'm a registered mental health nurse. I'm currently working in inpatient CAM services, hoping to still call myself newly qualified, so I've been working for about a year now. So I'm just going to talk a little bit about my dissertation project, which was looking at childhood adversity and children's psychotic symptoms, and that took the form of a systematic literature review. So some of the background research and stats showed that childhood trauma is a more powerful predictor of suicidal behaviour than the diagnosis of depression. And patients diagnosed with a psychotic disorder who have a history of childhood adversity are at greater risk of self-harming behaviours. 48% of adults in England have been exposed to at least one adverse experience in childhood, and 90% of people seeking support for severe mental illnesses have suffered significant emotional, physical and/or sexual abuse during childhood. So evidence that childhood adversity is a risk factor for the development of psychosis in adulthood is substantial, and that link has been quite heavily supported by the research that's been done, which has helped professionals to work in a trauma-informed way. So I thought that researching the presence of these psychotic symptoms in children who've experienced adversity could help to provide interventions that could potentially halt the progression of psychotic symptoms to psychiatric illnesses in adulthood. Early trauma-informed interventions could reduce the need for adult antipsychotic medication, which obviously comes with its own concerns. So the aims of my review was to combine the literature regarding children's psychotic symptoms and experiences of childhood adversity using a systematic literature search, and to hopefully draw conclusions that could support the evidence base that would influence then the clinical practices to prevent and treat psychotic illnesses among those who've experienced childhood adversity. So I searched 9 electronic databases and I used the population experience and outcome framework, and my population was children, my experience was abuse, and my outcome was psychotic symptoms, and those were my inclusion and exclusion criteria as well. So I looked through 234 articles, and after the whole process I ended up with 10 that were included for review. It's just a summary of the papers included for review. So, like I said, there was 10 studies included for review, and all of those studies found some link between childhood adversity and symptoms of psychosis in childhood. So the findings suggested that children exposed to stressful events and/or trauma are more likely to develop delusions and/or hallucinations, and children experiencing hallucinations relating to their traumatic experiences are more likely to have increased risk of self-harm and suicidal ideation, and are more likely to experience greater emotional distress than people experiencing those symptoms that hadn't experienced the traumatic life events. So these psychotic symptoms also occurred across a range of diagnoses, including schizophrenia, PTSD, mood disorders and anxiety. So 3 of the studies looked at the link between childhood trauma and the development of delusions. So theories suggest that the secondary delusion formation could indicate the deepening of those psychotic experiences and increasing the likelihood of these psychotic symptoms developing into a pathological psychosis in adulthood. Children who reported both hallucinations and delusions had experienced more traumatic and stressful events, suggesting that social adversity has an impact on the formation of delusional ideation in children that are already experiencing hallucinations. Exposure to traumatic events was also significantly associated with greater persistence and more severe audio-vocal hallucinations that could lead then to the development of delusions in an attempt to explain these anomalous experiences. Children who'd experienced any form of maltreatment were twice as likely to have high delusional scores, and more frequent episodes of maltreatment were significantly associated with the presence of delusional experiences, but not hallucinations, so suggesting the cumulative maltreatment may attribute to the development of delusions. So 6 of the studies examined different types of childhood adversity and the correlation with psychotic symptoms. So these types were kind of worded as sexual, physical and emotional abuse, bullying, so being bullied or being involved in bullying someone else, witnessing domestic abuse, and the level of betrayal associated with childhood maltreatment. Children who experienced maltreatment or bullying were 3.27 times more likely to report psychotic symptoms, and those who experienced both, so maltreatment and bullying, were 5.6 times more likely, again suggesting that there's a cumulative effect with these adverse experiences. Children abused by a parent were found to be at risk of alienation and social incompetence, and children who'd experienced sexual abuse had higher PTSD reaction scores. So children who'd experienced sexual abuse were more likely to abuse drugs, drink alcohol, experience nightmares, and were 5 times more at risk of suicide. These increased risk remained, even they did a multivariate model, so looking at age, gender, chronicity of symptoms, medication and diagnoses. So adolescents who reported psychotic symptoms were found to be 6 times more likely to have experienced physical abuse, and they were 10 times more likely to have witnessed domestic violence in their home, and again were more likely to be involved in bullying. The rates of hallucinations were found to be higher for children who'd experienced any form of maltreatment, but those who were emotionally abused and neglected, so that's kind of categorised as high betrayal, were more likely to experience both auditory and visual hallucinations. 2 of the studies then looked at the content of the hallucinations, and it was found that within a cohort of children diagnosed with PTSD and schizophrenia, their hallucinations had similar content. So PTSD patients who had a history of trauma reported greater emotional distress, thoughts to self-harm, and more suicidal ideation as a result of their hallucinations. And then similarly, children with a diagnosis of schizophrenia and a history of trauma had similar hallucinations that included command hallucinations to self-harm. So this suggests that the traumatic life experience actually influences the phenomenology of hallucinations. Children experiencing atypical hallucinations, so those were context-specific hallucinations or hallucinations that were responsive to secondary gain, were significantly more likely to have experienced any form of abuse. And those children that were experiencing the atypical psychotic symptoms, within a 2-year follow-up, they didn't develop a more classical psychotic illness. So that might suggest that those atypical hallucinations in the maltreated youths might be better attributed to an emotional behavioural disturbance or some kind of post-traumatic phenomena rather than the more classical psychotic illness. So I want to kind of draw all of that together. The variety of symptoms and diagnoses children receive suggests that children who've experienced adversity are at risk of developing a number of symptoms that may or may not develop into illness. Psychotic symptoms during childhood are likely to adversely affect development, whether they meet clinical threshold or not, so supporting the need for a focus on symptoms rather than diagnosis. Varying theories have been produced to explain the transition of psychotic symptoms in childhood to psychotic illness in adulthood. So the neurological theories looking at the hypothalamic pituitary adrenal axis dysfunction and the acetylcholine deregulation, and are suggesting that stress at a young age affects the development of these pathways, which is supported by the fact that adults who have experienced sexual and physical abuse show persistent sensitivity of the pituitary adrenal and automatic stress response. Some of the psychological theories is that childhood adversities can lead to the development of negative schemas towards themselves and also towards the world around them, which might lead to misunderstanding of situations, so seeing something as threatening maybe when it isn't, that might lead to then paranoid thinking and the development of psychotic symptoms. So the content that we found in the review, the content of the hallucinations for children who've experienced trauma is different to those who haven't. So this kind of supports the psychological theories that there is a development of negative schema, explaining the increased distress, self-harming and suicidal ideation they experience as a result of their hallucinations. It's also been suggested in psychological theories that actually voice hearing that results from trauma is a disassociated component of self, and also could be described as an appropriate reaction to really abnormal experiences. Some alternative theories look at the fact that delusions complicate initial hallucinations, that then causes a persistence of these subclinical symptoms and the transition then to illness. And that's supported by what we found in the review, that actually the formation of delusions being associated with how those delusions affect the children's behaviours, and the children experiencing both delusions and hallucinations had experienced more adverse childhood experiences. So yeah, these theories are really helpful. They're providing really interesting bases to go on, but I think future research will benefit from kind of combining all of these theories to see how they affect individuals. So some of the recommendations then from coming on the back of this review. We already know how detrimental psychotic illnesses in adulthood can be, and we found now that there is an increased risk of psychotic symptoms among children who have experienced adversity. So it just supports the vital importance of thorough assessment of adversity and psychotic symptoms within all children. Also supports the potential that early detection and effective interventions could change the course of pathology and prevent possible transition to illness. Also, just again, further research to explore the mechanisms that underpin the development of psychotic symptoms as a result of childhood adversity and the formation of delusions. This review supports the development of interventions that could be given to children who've experienced adversity to hopefully prevent those psychotic symptoms transitioning into adulthood illness requiring treatment, kind of including best means of assessing childhood adversity, identifying those that are at risk and intervening early. So I hope this contributed to clinical practice in terms of just highlighting the need for routine assessment of childhood adversity and psychotic symptoms, and that as clinical practitioners should all be able to assess trauma histories, and early and relevant interventions could prevent the transition to psychotic illness and reduce rates of suicide in this vulnerable population. I've got a long list of my references here, but yeah, thank you very much for listening.